Well, we're in the real heart of the therapy centre here because this is the Proton generator machinery itself. And with me is Vladimir Vondracek, who's the chief physicist, to try and explain what is all this thing doing.
This thing is accelerating the protons. This is called the cyclotron, where the protons are taken inside and they are accelerated on a spiral trajectory, and then they are extracted out of the accelerator with very high speed or very high energy, which is roughly half of the speed of the light, and then they are passed to the treatment room.
So if we walk through, then we can see the protons come out of the big grey hub and are fired down here, I presume.
Yes, sure. If you can see the metallic tube inside, this is the path of the protons. All the yellow stuff on it as the magnets that are basically focusing the beam or curving the beam trajectory to go to the correct place.
So all of this ends up concentrating on one single tumour, one single cancer,
yes,
in one single patient in a treatment room.
Yes, exactly. In this line, there is a very thin proton beam which is going directly to the treatment room, and then the beam is directed precisely to the point when we want to have it.
And presumably eats electricity to keep it going.
Yeah.
You were saying to me earlier, I think it's the equivalent of something like 2,000 domestic refrigerators.
Like that, depends on what kind of refrigerator you have. The power consumption of the whole line is something roughly 400 kilowatts, which you can transform it to the number of refrigerators. It depends on the consumption of your refrigerator.
And through those walls are the treatment rooms themselves,
yes,
the sharp end.
As you can see, the brick walls, after each brick wall, there is one treatment room, where actually patients are treated. So this is something which is hidden usually to patients. And also the staff, because when the accelerator is running, it's not possible to be here due to the radiation.
Well, let's go and have a look then. And so this is it. This is the treatment room where that proton beam comes all the way through the wall and presumably out of that machine there.
Yes, this is called nozzle. This is the final part of the beam line we have saw behind the wall. The patient is positioned on the treatment couch very precisely, also using by 2 orthogonal X-ray images.
And all of this takes 2 minutes and then the treatment's finished?
Well, yeah, the actual treatment takes, let's say, 2 minutes, 3 minutes. You have to take into account also the loading time, positioning time, and also our loading time. The whole time slot for one patient usually takes 20 minutes. If it is a child in anesthesia, for sure it takes much longer, let's say 40 minutes up to 1 hour.
And all of that, of course, with protons travelling at 150,000 kilometres a second.